Hello, and welcome to another Sussex Provincial Update. I'm Brian Zeiler-Kligman. I'm a Senior Associate in the Provincial Government Relations Group, focusing on regulatory and legislative issues. I'm joined by my colleague, Abid Malik.
Hi, Abid Malik. I'm the Senior Associate here dealing with healthcare issues here at Sussex Strategy Group.
So, for those of you who are fans of Sussex and are ongoing clients, you're probably familiar with us doing thought leadership pieces in the form of blogs that we've put onto our website. Well, now that we've got a studio, which we've been using to get our election updates to you throughout the weeks, we thought that we might make a transition from the written word to something on video. And so this is the first of those thought leadership pieces that we would share with you. Today we wanted to look at some of the top legislative and regulatory under-the-radar issues that are going to be upcoming with this new provincial government. So, Abid, our clients and those watching might be surprised to learn that there are issues under the radar, given how quickly things have moved with the new government. They're about a month into their mandate since they've been sworn in. We've seen a lot of activity, but people might be surprised to learn at this point there's actually only 4 bills that have been introduced. 1 has been passed at this point. And really, this is a government that, as indicated in their speech from the throne, that they will introduce legislation where necessary. Now, that being said, there were a number of pieces of legislation and regulations that were passed by the Wynne government just in the lead up to the election. And frankly, there's going to need to be a lot of changes done to have what is in place align with the stated priorities of the new government.
Yes, I mean, I think that what a lot of people may not necessarily know is that legislation may pass during the legislature and might receive royal assent, but Cabinet has the right to, in many cases, if it's written in the legislation, Cabinet has the right to decide when it's going to be enacted. So in many cases, in many of the pieces of legislation, especially over the past year, there's actually a line written at the end that says, will be proclaimed by Cabinet. And in many of the cases, the Wynne government had not actually proclaimed legislation or had put a date farther into the future in which it would ultimately come into effect. And that's what we're going to be talking about quite a bit today.
Indeed. So with that, let's get into some of these issues that we think people should be aware of that they may not be aware are actually issues on the horizon. So the first one we're going to turn to is cannabis. Now, admittedly, this isn't all that below the radar unless perhaps you've been under some rocks recently. But we know now that cannabis is going to be legalized for recreational use as of October 17th. What we don't know necessarily is what that retail environment is going to look like here in Ontario. So we've seen some issues, some rumors have come out to suggest that there may be privatization in terms of retail storefronts. We still expect the online sales are going to be going through the Ontario Cannabis Retail Corporation, which was established by the previous government for this purpose. But you know, it's not just the it's not just the recreational side that might be seeing changes. It also could be the medical side.
Oh, absolutely. For example, the Smoke-Free Ontario Act, which was part and parcel of the previous bill, was supposed to come into effect on July 1st. And when the new government came in, they decided to hold off on those new regulations as it related to the Smoke-Free Ontario Act. And what that would have done is make vaping, regulations around vaping consistent with those around with smoking. And that was part of the cannabis bill, because in the cannabis legislation, it does allow people who have cannabis for the purposes of, for medical purposes, to be able to smoke it in public, not recreational. So those who would obtain it or who consume it for recreational purposes would not be able to consume it in public, except those who, except in areas that are very consistent with that of smoking. So, for example, no patios, can't take it into the movie theater with you, and so forth. So, and then to harmonize that as well with vaping. And so those regulations were supposed to come into effect July 1st, and we're not. that has the potential to be reviewed, and especially since October 17th is when the legalization will happen, one can anticipate that the government is very much working on that. The other piece, of course, is the fact that if the government is flexible on the idea of who can dispense and sell cannabis, there's an opportunity potentially for it to be dispensed, for example, in other retail outlets such as pharmacies for medical purposes. So that's why these reports that came out indicating that the government is considering changing the retail model is very interesting for a lot of different people.
Mm-hmm. Well, that's really the key point here. So what really does this mean to you? And ultimately, if there is a change in retail, and obviously this has been rumored but yet not yet actually announced by the new government, this has immediate impacts obviously on those who are interested in getting into the retail game in terms of cannabis, as well as, frankly, in most provinces across the country, the cannabis retail regime has mimicked the alcohol retail regime, and since the Ford government indicated that they'd be liberalizing alcohol retail here in Ontario, we certainly would expect that whatever comes out on cannabis is probably going to be mirrored on the alcohol side. But frankly, everyone is going to ultimately be affected by this, whether it's human resources issues, whether it's people who sell ancillary products, people who are not interested in being in a strip mall with a cannabis retail shop. Everyone is going to be affected in some way by what changes happen with this legislation. So really why we think that it's something that should be on people's radars. Not to mention that there are also natural health products out there like topical treatments and other oils and so forth that contain CBD that really kind of in a gray area. We're not sure exactly where they're going to be sold or how. And that might be addressed within this as well.
Yeah, and I think that the fact is that the federal regime does come into effect October 17th, regardless, and the government is going to have to be prepared. So at some point, if they want to make changes, they're going to have to make them pretty quick.
Absolutely.
So now what we're going to talk about is the Employment Standards Act. The Wynne government, right before the election, made a variety of different changes to the Employment Standards Act, including minimum wage. And the Ford government, or Doug Ford, during the election, as part of their election platform, had different ideas about where that should go and what he would do if he was elected premier. He is now premier, and so what do you expect is going to change with respect to the Employment Standards Act and the changes made before the election?
Absolutely, and people watching at home, they probably remember the minimum wage increase that took place. However, the legislation that actually introduced that was sweeping in scope. It introduced all sorts of changes to the Employment Standards Act. It also introduced all sorts of changes to the Labor Relations Act. And those changes were staggered in that some of the changes have come into effect. A number of the changes are actually not coming into effect until January 1st of 2019. So employers have already felt this impact in some ways from this legislation that came into place, and there's still more to come. Now, most significantly, just in terms of public profile on this, is that on January 1st, 2019, and this is written into the legislation, is when the next increase in the minimum wage to $15 an hour comes into effect. And we know from the Ford government's election promises that they're intending to ensure that the increase in the minimum wage stops at $14, where it currently is. So that means that they're going to have to open up that piece of legislation in order to amend it. Now, if they're opening up that piece of legislation, all sorts of other provisions, like those surrounding scheduling, sick day provisions, vacation pay, all sorts of other pieces that were in that employment standards part of the bill will be looked at as well, and that there's an opportunity for people to say, this is going to affect me in a variety of ways, and we should reconsider on some of these. And similarly, not explicitly necessary, but probably going to happen at the same time, are the changes to the Labor Relations Act. So, we do expect to see some changes on that. And really on the health side, there were some changes, some explicit impacts as well that would be felt by some of these changes.
Well, absolutely. I think across the board, and healthcare is not excluded at all. There's a variety of different employers, whether it's community healthcare providers, whether it's lab providers, pharmacies, even within hospitals. There were people who worked for less than minimum wage and who were bumped up. And of course that causes compression issues. So those who were just above $14 were all of a sudden also looking to see, although it wasn't mandated, also were looking for raises as well. So it created a significant amount of pressures from that perspective, but also scheduling. And I know that there was some minor changes made right before the passage of the legislation. But for example, if there's a health scare or for some reason there's a surge in healthcare demand, for example, due to infection or flu, and the hospital or the provider needs to staff up very quickly, the 48-hour notice that is in the new legislation provision doesn't necessarily help things. It's not something easy that they can do. So there's a variety of different pieces there that while there was some changes made, that once you open up an act, you can imagine a situation where a variety of different groups are going to be asking for different things.
Mm-hmm. So what does this mean? And again, much like with the cannabis legislation or regulations that are going to be coming out, this is going to impact all sorts of businesses. And when Bill 148, which was the piece of legislation that introduced these changes, was passed, it did receive a fair amount of opposition in a variety of quarters, but it was not all necessarily vocal as we might expect it to have been, and it wasn't necessarily as focused on the other issues other than the minimum wage. We know the minimum wage is going to be dealt with. The question becomes, does the government deal with some of these other, what we know are pain points, frankly, for employers? So it's really important, if employers are looking to get some of these dealt with, that they take actions to make sure that their concerns are known, so that when this legislation is opened up, they have the opportunity to address those.
Absolutely.
So the third file we wanted to look at is one that was referred to as the Health Sector Payment Transparency Act. And I know that this was a big concern on the healthcare front, Abid. So what exactly was it?
Well, this was a part of a larger bill, an omnibus bill that the government passed in December of last year, called the Strengthening Quality and Accountability for Patients Act. Amongst the various pieces was a comprehensive piece of legislation that would mandate those certain payers, certain companies within the healthcare sector who are involved in the healthcare sector, to disclose any payments that they make to certain recipients. So, for example, a drug company, if they sell pharmaceutical products into the healthcare sector, and they make a payment, for example, to a physician, or even to serve as a consultant, or fund some of their research, or even sponsor an event for an association, all of those various payments would have to be disclosed, and literally, the per payment on a line-by-line basis with a description, and then rolled up and sent over to the government on a yearly basis. This includes, for example, taking a physician out, or any healthcare professional out to lunch, and if the lunch is over $10, that would have to be disclosed. Of course, the rationale behind it was to determine whether or not there was any influence, or what kind of payments were being made, to determine whether or not potentially there was some influence. It wasn't necessarily there to pass judgment on those payments, but to at least put that out in the open so that people can decide for themselves. There are certain pharmaceutical companies who were actually very much in favor of this, of the transparency. They wanted to create a level playing field, and I think some of them have voluntarily disclosed on an aggregate basis, although not on a line-by-line basis. But there are others, and a whole host of others, who might feel that this is a bit onerous, because it's not just pharmaceutical companies; it's medical devices, and it's those, generally speaking, who sell into the healthcare market. So I think that the government is going to have to make a decision about whether or not it intends to move forward with the regulations that were posted by the Wynne government back in where comments were due by April 6th. but have still not been proclaimed. So this is a piece of legislation that has not been proclaimed. One might think that the Ford government might view this as additional regulatory burden on businesses, even though it does involve public dollars in many cases. Although the legislation doesn't necessarily deal only with public dollars, it also deals with those on the private side as well. It's unclear how they're going to react. But the original timeline was for this legislation to be in effect, so that for the 2019 calendar year, all payments would be kind of recorded and had to be sent to the ministry in 2020. We'll have to see how that works.
Absolutely.
I think that the interesting thing about this is that just the regulatory burden on businesses, the offenses in there. One of the things that I read that stood out at me when I looked at it was that the fines were $50,000 per day, very hefty fines, no imprisonment, but it just goes to show you how important a piece of legislation this is that has not yet been proclaimed. I think the next piece we want to look at, Brian, is anything related to, for example, the development industry. Mm-hmm. And there's a variety of different pieces of legislation and a variety of different regulations that the government was moving forward with as it related to the development industry. I was wondering if you could provide some of your thoughts on, for example, the Ontario Municipal Board and what happened there.
Yeah, well, we here at Sussex, we acted for some clients with respect to the changes that were brought forward on the Ontario Municipal Board. And certainly the changes have been enacted. So there is now in place a local planning appeal tribunal instead of the Ontario Municipal Board. And the idea with that is that it gives greater powers to local politicians in terms of making decisions with respect to development. Interestingly, right now there are concerns amongst the development community, there are concerns amongst local politicians and municipalities, pretty much everyone involved in the system, really unsure how it's going to play itself out, but also each having some concerns about perhaps it didn't go far enough, perhaps it went too far, and really not quite sure about this new regulatory regime. And certainly we know that there are many voices coming from many quarters suggesting that there are some changes, even though it hasn't been tested yet, and even though it hasn't really been in place that substantially just yet, there are some changes that need to happen to this. And we've had the Bill 5, the Better Local Government Act, that was introduced, which is proposing to shrink the size of Toronto City Council. Well, if you're giving more power to local politicians to make development decisions, and then you're shrinking the number of councillors that are there, that's only going to increase the power that's in place for those local politicians. So we're expecting to see that, from a development perspective, period, there are some concerns, and that we would be interested to see. This is one of those that's below the radar, unless perhaps you're in the industry specifically, but certainly a burning issue there that people want to see some changes with.
Yeah, and I think there's also, for example, the building code. Every 5 to 7 years, the building code is supposed to change, or at least be updated every 5 to 7 years. There was a consultation period last year as related to the building code, and some of the proposed changes from the Wynne government related to their climate change action plan, updating building codes so that to reduce energy consumption to almost zero. And so some of the proposed changes included, for example, ensuring that there was outlets for electric vehicles in new buildings that were created. Supposed to come to effect, notionally supposed to come to effect January 1st, 2019, but it's unclear whether or not the government is going to make changes or whether they're going to let that particular building code as written that is so focused on environmental sustainability and climate change, if they're going to let that be enacted as of January 1st, 2019. It remains to be seen. Mm-hmm. Also, with respect, one of the things that I noticed as well was that there was new regulations as it related to reducing red tape. So this is an example, I think, of a piece of legislation that passed the government and was actually proclaimed. So it's in effect. However, the current government, and especially during the election campaign, made it clear that they wanted Ontario to be open for business. And one of the ways to do that is to reduce the regulatory burden.
Yeah, so when Bill 148, which was the bill we spoke about previously that made all the changes to the Employment Standards Act, raised the minimum wage, Labor Relations Act, came into effect, around the same time the Wynne government introduced the Reducing the Regulatory Burden Act, reducing red tape, which committed the government to reducing by $1.25 the regulatory burden for every dollar of new regulation that they introduced. And this is actually in effect, and it's the law of Ontario at this point. Interestingly, as you noted, obviously the new government has indicated they're wanting to make sure Ontario is open for business, and that's clear to everyone. In fact, even with the naming of the deputy ministers, there is now, in fact, a deputy minister who's responsible strictly for the reduction of the regulatory burden, which also happened to be formerly the deputy minister of economic development, which is where this piece of legislation resides. So would be quite familiar with this.
Right.
So, philosophically, this would seem to be a piece of legislation that probably wouldn't be touched because although it was introduced by a Liberal government, it is philosophically in line with where the PC government wants to go. However, the PC government may have a different way that they want to go about reducing the regulatory burden, and certainly how it ended up being rolled out by the Wynne government, where it was the government usually proposed both how much it was going to cost in terms of new regulatory burden, as well as how they were going to offset that increased cost, as opposed to letting stakeholders point out, not individual companies, but on an industry-wide basis, here's where there's regulatory burdens on our industry, and here's how you could reduce the regulatory burden. So I would suspect, at least from a policy shift on this, that you're going to see an opportunity for there to be the offsets on new regulatory burdens that that stakeholders are actually going to have an opportunity to weigh into that, propose what those might be. And that really is where, why this might be of importance to people who are watching, is that ultimately, if you operate in Ontario, you're regulated in some way. And there's going to be some level of regulatory burden that you're going to be facing. This piece of legislation, either it gives you an opportunity to go into government, to the new government, to let them know where you're experiencing pain and how they might be able to ease that regulatory burden. But it also might lead to a new policy change in terms of how they're actually implementing this piece of legislation so that open consultation does take place.
Yeah, I mean, it almost seems like there's an opportunity that this government might feel that legislation simply didn't go far enough. Mm-hmm. Whether it translates into, instead of $1.25, $1.25 for every dollar in new regulations, maybe it might be $1.50 or $1.75. Mm-hmm. But at the end of the day, there's the potential for it to be reopened and to make it go further.
The final file that we wanted to look at today is another one of these that probably got missed in the lead up to the election. It passed, I think, the day before the writ dropped, which is the Pay Transparency Act. And so this is another sweeping piece of legislation that will affect all companies, all organizations, frankly, in Ontario, as to disclosure with respect to payments to employees. Now, there's a very specific rules in place with respect to disclosing employee salaries and differentials between employee salaries. It's all based on certain levels of employment. So first, starting in 2019, the Ontario Public Service is supposed to be making the disclosure. Starting in 2020, it is companies who have more than 250 employees. And then starting in 2021, it should be companies that have more than 100 employees. That seemed to be easy enough, or at least clear enough. However, there actually are a number of pieces of the legislation that apply to everyone, regardless of whether you employ 100 people, 500 people, or 5 people. Things like all of your job postings have to include a salary range or an actual salary rate on them. You're not allowed to be concerned about whether or not your employees disclose their own salaries to themselves or to others. So there's a few different provisions within there that, frankly, just people might not be aware even exist and are going to be new burdens upon them or expectations upon them starting in January. And this is really something that people they need to be aware that there is this legislation out there. Some of it is ill-defined still and frankly will need to be better defined. But ultimately, there are a number of provisions that are going to impact everyone, particularly starting in January of 2019.
Oh, absolutely. I mean, I think that this is an example of an additional regulatory burden that's being placed on businesses that does not necessarily jive with the philosophy of the new government. And although they haven't made any specific commitments on this, one can expect that potentially something can happen from the PC's perspective, from Doug Ford's perspective. I think that he's going to have to balance the need to reduce the regulatory burden without coming across as being against equitable pay in the private sector or in any sector. So it's going to be quite interesting to see how that plays out.
Absolutely. Well, there you have it. Those are 6, we would say, below-the-radar files that are going to require some level of legislative or regulatory action by the new government. And people may just not be aware of them, and it's still possible that they're going to affect you. A number of them are so sweeping in scope that they are going to affect everyone in Ontario. So, just an example of a few of them that are out there that, even though they're not necessarily part of the election mandate of the PC government, still will likely need to be dealt with at some point and early on, frankly, in the legislative session. We know that this government is very much focused on the other parts of its toolkit beyond beyond legislation. So more looking at things like regulation or policy statements that they can use. Sometimes the tax and spend component, but in some cases they're going to have to look at regulation. They're going to have to look at legislation on some of these files and others. And so we know action is going to have to be taken.
Yeah, and they're not afraid to bring back the legislature, that's for sure.
That's for sure. So, as we've seen already in this first month, this is definitely going to be an active government. They're going to be a responsive government. I don't know that we should use the term activist. I think that's the wrong connotation, but certainly active in their actions. But we also have found, frankly, that they're a receptive government. They are wanting to hear from stakeholders. They are ready to listen to stakeholders. They're also expecting stakeholders to have done their homework before they come to them. And that's really something that we feel at Sussex that we can do a really good job of helping anyone out there, whether it's a company, whether it's a nonprofit, whether it's a union, that is industry association that's looking for a way to engage the government on some of these files that are out there.
Yeah, and I think the word common sense sometimes comes up. Common sense ideas that make a lot of sense, that are evidence-based, they're going to be receptive to. And during the election, they did say that they wanted to consult with stakeholders more, and to better understand and to be the one who listens to concerns as well. That's something that we're finding so far, and we think that there's an opportunity for anyone out there who wants to have their say in any of these pieces of legislation or other pieces of legislation or something completely new. There's an opportunity because there is, at the end of the day, a government that may not necessarily agree with you, but at least they're willing to listen.
Absolutely. Well, thank you for joining us. We hope it's been illuminating for you, and we'll see you again soon.